Ligia Ricciardi. I'm the Chief Transformation Officer at Carium, and I'm here in the Digital Health Live studio at CES 2020, and I have the pleasure of interviewing Dr. Michael Moffitt, who's at Boston Scientific, where he's the Director of Research and Development. Welcome, Michael.
Thank you, Ligia. It's nice to be here.
So you just participated on a panel. You were talking about neuromodulation.
Yes.
Any high points you'd like to share?
Neuromodulation is a really exciting space right now, Ligia.
Maybe we should define it a little bit for folks who may not be familiar.
Okay. Well, maybe we could compare it to pharmaceuticals as an example.
Sure.
So in neuromodulation, what we're trying to do is excite specific neurons that lead to therapy.
Yeah.
And so it's comprised of an implantable stimulator.
Yeah.
So it takes a surgery to be that specific, but it has far fewer side effects than, say, pharmaceuticals that are systemic in nature. So that's in a nutshell how neuromodulation works. So our electrodes are near the brain or the spinal cord or other nerves.
And is it sometimes used to complement pharmaceuticals, or is it usually sort of a one or the other pathway?
No, they can be used together. They're often used together. So the primary indications or disease states that are treated right now are chronic pain and Parkinson's disease. And in both cases, there's situations where patients will continue to use pharmaceuticals to complement the therapy that we provide through neurostimulation.
And is this a fairly new way of treating disease, or has this been around for a while?
I appreciate the question. So it's been around for a long while, actually. It's not nearly as new as many people would think. The first patient that received a spinal cord stimulator was reported in a journal article that was published in 1967.
Wow.
So just by way of historical context, that's 2 years before Apollo 11 took us to the moon. So a long time. People have been working to map the brain even before that. Although over the last few decades, it's become the therapy has become much more refined, both in the brain and spinal cord stimulation for pain. A lot of progress, and they're really excellent therapies treating hundreds of thousands of patients.
And where do you see it headed?
Where do we see it headed? Because it's in the brain, once you're in the brain controls so many different aspects of physiology. You start to think about all sorts of neurological disorders, psychological disorders, autonomic disorders. Anything that the nervous system touches is a candidate. And there's research in neuromodulation across the spectrum of indications right now. So there's a big future here. We're at the tip of the iceberg, scratching the surface, so to speak.
Well, that's exciting. Thank you, Michael.
Appreciate
you joining us here at CES 2020 in the
Appreciate it.
Digital Health Live studio. Take care.
Thanks.